All right, at this time, we're on item 8.0, and I'm going to turn it over to Dr. Little to introduce our special presentation.
Thank you, Madam Chair. It is my pleasure tonight to have Dr. Shane Phillips, the Accountability and Assessment Director, as well as Nurse Amy Wood, our Nursing Director, the District Nursing Director. Going to talk to us a little bit about the survey results, as well as kind of COVID impact by the numbers, I think is one of the things they're going to talk about.
Okay, Madam Chair, members of the board, and Dr. Little, tonight Nurse Amy Wood and I will be discussing the impact of COVID-19 on the district, as well as the results of a survey of our district's households and staff regarding the use of masks in our schools and offices. Oh, Josh. It is? Okay. First, let's take a look at the comparison of some of the numbers from last year to this year.
Dr. Phillips, would you pause for just a minute? Do we have the presentation?
Sure. Yeah. You can go on the second one, Josh. You have the clicker.
The wonders of technology.
Thanks, sir. Okay, I'm back. All right, first, let's take a look at a comparison of some numbers from last year to this year. In terms of positive student cases of COVID-19, in the entire 2020-2021 school year, we saw 1,598 unique students reporting an infection. This year, as of September 17th, that's day 23, we have already seen 1,940 cases. COVID-19 has also been affecting our youngest students more. Last year, elementary age students accounted for 515, or about 32% of our positive cases. This year, we have already seen 787. That number is almost 41% of our positive cases to date. Last year, we averaged about 9 positive student cases a day over the course of the school year. As of September 17th, that average is 88 cases a day. For our staff, last year saw 604 positive cases. On day 23, we had 288. So far this year, our highest number of COVID-related absences among employees has been 304 employees in a single day. That is 304 of our first string on the bench. 19 of our employees have been hospitalized or have had a significant health issue related to COVID-19 so far this year.
So one thing that we really want to focus on is that last year, it took quite a while for us to see any evidence of in-school spread. And although we did see a small amount, by and large, that was not something that we were seeing in our schools. It took us until December of last school year for us to have to quarantine our first classroom due to an outbreak. And an outbreak is considered 3 or more positives in a class within 14 days. And so we had about a dozen of those all school year last year, with the first one coming in December. This year, we quarantined our first classroom due to an outbreak on day 7 of school. That means at least 3 students in that class came to school, became symptomatic, went home, and tested positive all within the first 7 days of school. We have had over 140 now. That 140 was as of September 17th. 140 classrooms that have had to be quarantined because of an outbreak. Last year, something that we didn't see was students transmitting potentially to adults. It was the other way around. We had adults, and if they were in the classrooms, they were transmitting it to the students if we had any in-school spread. This year, we are seeing kind of the opposite. We can see the numbers in our students go up, and then within 2 weeks, we can see an increase in numbers at that school in the staff as well. Our student quarantines, the ones that have turned positive so far this year, is at 7.1%. So 7% of the students that we quarantine become positive during that quarantine time. The peak number of students out in a single day so far this year was 6,150 face-to-face students who were not in the building, and that's almost a quarter of our student population. So many of you have probably seen this, which is the Swiss cheese model to mitigating respiratory viruses. And what this represents is that there is not one single intervention that will prevent spread. It is a combination of things that will prevent spread. So as you can see, we start on one end with physical distance. That has been limited this year. We are not able to distance like we would want to. We have more students this year in person. Part of that is due to the limitations of how many we can have in the Lula program. Masks, that is only, that's only as good as the people who are wearing masks. So that is universal mask use. That's not happening, so we really don't have that. We do still have hand hygiene and cough etiquette that we teach our students and staff. And then you go down a little bit, you see if crowded, limit your time. Our schools are considered congregate settings. That means a large number of people come together in one area for a lengthy time. And we can't limit that, so we can't use that as a mitigation strategy. Ventilation, outdoors, air filtration. So our schools, whenever possible, are utilizing outdoor spaces. But today was a good day to prove that that's not always reliable. And then we move over to quarantine and isolation and vaccines. We do have a number of students that are receiving the COVID vaccine. And as we see that number increase, we will see, a benefit to that. Quarantine and isolation is probably, out of all of those, the one thing that we are doing pretty much by the book, and as it was intended. And so when you've got all of those pieces that are not able to be utilized, once we get to the point where things are overwhelming the ability to quarantine and isolate, the one thing that we have left in our bag to use is shifting schools to e-learning.
So far this year, we've shifted 9 schools to an e-learning model. And you can see the dates on which we did those on this chart. All of these schools have since returned to face-to-face instruction. Based on this time series of positive cases shown here, we seem to be trending with community spread. While we don't really know the ultimate impact of e-learning and these shifts for schools, as the spread in the community and schools rises, shifting the schools that are hit the hardest to a virtual model allows us to reset the clock a bit, allows these schools to recover students, and then return to face-to-face instruction. As you know, Proviso 1.108 prohibits school districts from using state funds to enforce mask requirements. The district wanted to take a pulse of how our households and employees in Lexington One felt about the use of masks in our schools and offices. To do this, our office was asked to conduct a short survey. This survey consisted of a single question that asked respondents which statement they agreed with the most. First, the Lexington One Board of Trustees should consider temporarily requiring masks in times of high community spread as designated by DHEC in order to maximize face-to-face learning, or masks should remain optional in Lexington District 1 schools, and the Lexington District 1 Board of Trustees should not consider temporarily requiring masks regardless of circumstances. We wanted to make sure that the results of this survey allowed for valid inferences about the views of our households and employees, so we took steps to that end. We used a survey system from K-12 Insight to create and distribute the survey. This allowed us to distribute the survey as single-use links in order to avoid the submission of multiple responses by individuals that we have seen in the past. The survey was translated into Chinese and Spanish, and users could select the language of choice when they opened the link. For the parent survey, we used the primary contact in PowerSchool for the invitation. This helped to ensure that in the vast majority of cases, we received only one response per household. This made the responses more equally weighted than if we had done a per parent or per child survey. For example, we felt that if a family with a single parent deserved the same amount of voice on this issue as a family, for example, with two parents and a step-parent. Similarly, we felt that families with a single child deserve the same weight as a family of multiple children. Invitations were sent out to all employees at their district email addresses. We did encounter an issue, mainly with Yahoo and AOL email addresses, where there were substantial delays in delivery of the invitations. To be clear, this appears to be an issue with certain services like Yahoo and AOL, and possibly some others who, by design, throttle back delivery after a certain amount of emails from a single sender. We worked around this using an in-house solution where we sent a reminder email through our school messenger system to those email addresses that had not responded. So a big shout out to our IT and communications for making that happen. At the close of the survey on Sunday evening, we had received responses from almost 75% of primary parent contacts and 81% of employees. This is an extremely high response rate. While some error is inherent in all surveys, since we had such a high rate of response, we were able to calculate 99% confidence intervals that resulted in a small margin of error. Generally speaking, in social sciences like education, a common level of confidence is 95%. Here are the results of the parent survey. As you can see here, almost 70% of our households represented by primary contact responded in favor of the board considering a mask requirement in times of high spread. With about a 1% margin of error, we can be 99% confident that these results in the sampling frame of 17,509 households would fall somewhere between 68.8% and 70.8%. The staff survey results were similar to that of parents. About 69% of employees responded in favor of the board considering a mask requirement in times of high spread. With 99% confidence, we can estimate the actual percent of households in favor in the sampling frame is somewhere between 67% and 71%. At this time, I'd be happy to answer any questions.
Hey, this is Jada. I just have a question. Did staff get the same survey as students?
Okay, students didn't receive the survey,
Well,
but
parents,
staff,
yeah,
yes,
that's
ma'am, staff got the same survey as, not the exact same survey. We did a separate survey for staff and parents, but the same question was on them, yes, ma'am.
Okay, the same question was on that. And could staff respond to both surveys if they were a parent?
They could respond as a staff person and as a parent, but those were reported in separate surveys. So
Okay,
the results as an employee were reported in their employee survey, and as a parent reported in the parent survey.
okay, can you go back to that last slide? I just didn't get finished
back?
writing down. Yes.
Yes, ma'am.
I didn't get finished writing down those numbers. Thank you.
Yes, ma'am.
Does anybody else, any board members have a question for Dr. Phillips or Ms. Wood about the survey? No, no questions? I do think it's interesting, anticipating the survey results coming out. I was looking at the news on Sunday, and Fox News actually did release a report on Sunday, and they had conducted a national, and they're you know, they use a national polling company that does, you know, like these really robust surveys. And they had surveyed a valid sample of 1,002 registered voters nationally and asked very similar questions. And on the question about masks, would you support the use of masks in schools? The agrees were 68%, which I think it tracks right with the percentage that we see. And I thought that was really interesting, that it was very consistent, you know, when we got our results, that, you know, that seems to be the opinion of a lot of folks nationally, that schools, you know, maybe ought to be able to mask when there's high spread in order to keep students in the classroom and in face-to-face settings. So I thought that was interesting.
I have a question, and I'm not sure if y'all, but Ms. Gaskins or others, but have our teachers given us feedback? Because when we switch to a virtual and then back to an in-person, all those transactions obviously lead to confusion, and my guess is it interrupts the learning rhythm. But can y'all speak to the cost of moving back and forth between virtual and in-person?
I'll just say that what we learned from our teachers was that even though the disruption going back and forth was an adjustment for students, being able to teach in one modality and give all of the students attention was actually a plus of moving to e-learning and allowed them to sort of reestablish some things instructionally. And I think that some of the things that we put in place at the beginning of the year, like the week at a glance, helped to provide some infrastructure to really support us going back and forth. But it is an adjustment every time we switch.
You know, from some of our brothers and sisters in other districts, they've given us feedback that the benefit of their masking was that they were able to keep more kids in the classroom. So.
Madam Chair, you know, this is obviously a little bit of a hot button topic. And, you know, while I think we've reviewed the survey results and those kind of things, I would put in a point of consideration that maybe this would be a good time for us as a board to just kind of talk about this.
Okay, Dr. Guyton, you want to start?
I
think
didn't
that's a great
necessarily
idea.
volunteer, but
When you have a great idea.
I guess I was voluntold. I'm sure people in the audience have felt the same. You know, if we're done, I don't want them to have to stand in the
Yeah,
back.
thank
I mean, if y'all are done, I appreciate, you know.
Y'all can sit. We're going to talk.
Okay, where do we start? So, I'm an old country boy, so let me tell you a story. As a physician, I found myself in India one time, and I was on a medical mission trip there, and I had gone to a completely unreached people group. We climbed a mountain. Believe it or not, I actually climbed a mountain. And we encounter a group of people who have never seen an outside person. And as we're walking into the village, they are literally hurling curses at us. And I remember thinking, what are we doing here? And part of you kind of wants to run and hide, and part of you just kind of wants to keep going. So we kept going. We went into the village. And if I'm being completely honest and transparent, these days kind of feel a lot like that here. You know, you go in with the intention of helping people, making a difference, doing what you can, and as you're walking in, you're being hurled insults. Now, sometimes we do it in a little more polite Southern way, and sometimes we just frankly tell people, you know, we're told what people think, in not so nice phrases. But as we're there, I have this very old, crippled lady walk up to me. And when I say she's walking on her ankles, I mean she is literally walking on her ankles. Her feet are completely turned in. And the only thing I could offer her were some Tylenol. And I remember thinking, this is how completely useless and helpless I feel, is that I can provide her nothing. As this poor lady walked up to me. And again, these days feel kind of a lot like that. I think it's fairly clear the budget proviso prevents us from making any decision regarding masks. That power or authority or whatever you want to call it, decision-making, has been taken away from us. You can try to mix words about it, but at the end of the day, the proviso is pretty clear. They want that decision left at the highest level within our state. I think when it comes to quarantining and isolation, the same thing exists. That decision rests with DHEC. Recently, Ms. Garris, as we were chatting about this one time, she was able to locate an opinion from the Attorney General that said, let's see if I can find it. This is an Attorney General, our state Attorney General's opinion. If a school district's protocols are in compliance with this publication, a court would likely find such protocols are consistent with the general law of this state. And what they're referring to is the South Carolina DHEC exclusionary list. If you go to then the South Carolina DHEC exclusionary list, not only does it include the COVID-19 if someone has COVID-19, but it also includes close contacts of COVID-19 and quarantine guidelines and those kind of things. So even the Attorney General comes out and says DHEC is the rule of the law, rule of the land when it comes to quarantine and isolation. So again, we don't really have any legal ground for that. And then the thing I find most interesting is if you look at our current situation, so we're under a proviso that prevents any sort of mask mandate. We have DHEC as local health guidance providing us with health guidance that you should be masking indoors, vaccinated or unvaccinated. Then we have the COVID immunity bill, which says if you're following local health guidance, you can't be sued for anything associated with COVID-19. So I asked some members of the General Assembly, who writes the check? Do we write the check or does McMaster write the check? Somebody's got to write a check if we get sued. No response. This is the situation that we find ourselves in. So to say anything to us, and this is my opinion, to say anything to us about mask, isolation, quarantine, vaccines, testing in schools, anything of the like, is kind of like yelling at your postal delivery person about your electricity bill. He or she can't do anything about it, nor can we. We hear everything. We hear the impassioned cries of people for and against masks. We hear the impassioned cries of people for and against quarantining, vaccines, everything. We hear all that. We're humans. We struggle with the same things. What is infringing on your personal liabilities? What is the best thing to do for the community? What is the way to keep our most precious and dear and medically fragile students safe? We struggle with all of these things, but we're powerless to do anything about it at this point. And I find that incredibly ironic in a state that is generally so against federal regulation telling us what to do. We're locally elected officials, and we can do nothing about it. Sorry if I took too long.
Thank you, Dr. Guyton. Anyone else like to offer comments about kind of the predicament that we're in? Anyone? Well, and I would just, I think Dr. Guyton did a very eloquent and thorough job addressing the situation that we are in as a local school board. And I'll kind of start with one of his final points. You know, we live in a state that has been historically extremely resistant to a strong central government in Washington. But what we're living in right now is a strong central government in Columbia that has taken away the ability of locally elected officials who were elected by the same people that sent our General Assembly members to Columbia to take care of our schools, to manage our schools, and to take care of our students and our staff. And I'm not sure that the will of this board would ever be to implement a mask requirement. But we can, if we have a situation in November or December where one of these other variants comes down the pike and it's worse than the Delta variant, we don't have any tools available to us to keep our students safe. And I don't think that is consistent with how local government is supposed to work. We're able to meet with 24 hours notice. If something happens, we can meet with 24 hours notice. The General Assembly doesn't meet again until February. And so if something catastrophic happens with COVID in the next 3 months, something that none of us anticipated. None of us anticipated any of this 2 years ago. I mean, this has been the craziest year and a half any of us will probably ever deal with. But the General Assembly, they're not nimble, they're not flexible. They have a schedule. They'll come back in February and take up, what's on their agenda. We can react to keep your students safe. And I'll tell you right now, and Dr. Guyton is right, we get lots of emails, phone calls, really I've received some very ugly voicemail messages. And I promise you, there's not a person up here against that wall, any of these buildings, that their number one priority is our students and their safety and their education. Nobody is trying to take away your freedom. Nobody is trying to tell you what to do. We're not tyrants. We're here because we love students and we love our schools and we want them to be the best and we want them to be safe. And we're really just trying to figure this out as we go along. And I'll tell you, we are not voting on a mask requirement tonight. That is not something that's under consideration. We're not going to do that because the other thing that we do in Lexington One is our job is to grow future citizens. Every one of our students is going to be a future citizen one day. And a good citizen follows the rules. Even when you don't like the rules, you follow the rules. And then you get to a position where you get to make the rules. And so we're modeling for our students that we've been given rules that we're going to follow. And we've been told that we can't do a mask requirement, and so we're not going to do one. But we are going to talk about tonight asking the General Assembly to give us back the authority that really it belongs to us. And you can disagree with that, and that's what this forum is for. But I just want to assure you that we are all committed to doing the right thing for students. That is the number one goal. No one is trying to do anything other than that very pure motive. And so that's my comments. Would anyone else like to speak?
I was just going to say, this survey going out, I think, further divided the community, seeing as how we can't implement a mask mandate. According to the email the parents received, it says the board is considering a resolution so that local control can be given back to school boards to implement mask requirements. However, this board has never voted on mask or anything related to COVID. And people were shocked last time they showed up here during citizens' participation, and I had to tell them that. But we keep leading them to believe that. There's nothing in this resolution or the survey that says control will be given to the school board. In fact, the information provided to the board says the attached resolution urges the General Assembly to repeal Proviso 1.108, thus putting control back in the hands of the district to make temporary decisions. So, I mean, I'm not so sure why we sent out a survey and just basically caused chaos if there's nothing we can essentially do about this.
Thank you, Ms. Garris.
Mm-hmm.
Anyone else? Okay, thank you. Dr. Little, would you like to address before we move on?
Well, I will say, one of the things, cautiously optimistic, just again, that'll be part of my Wednesday message tomorrow. Good news is the last 2 weeks, our numbers seem to be trending back in a better direction than they have been, which is, again, we think about kind of the struggle that we've been through throughout the course of the year. I think it's at least a good sign that something positive like that is happening. So that's a good part. We're certainly tracking those numbers very carefully and hopeful that that will continue. Certainly, 2 questions that we still have, I think, as we move forward, and I don't know that, if we had that kind of crystal ball, maybe we would, go to Las Vegas or buy a lottery ticket or do something like that. But we're still wondering about where the level is over the course of time that will settle into our COVID-19 infection. So what we saw at the beginning of the year was a huge spike in numbers that really dwarfed last year's numbers by a lot. I mean, you saw already 1,940 positive cases as of Friday. I think as of this morning, it was like 1983, somewhere in that ballpark. And then you look at this huge spike. MUSC kind of talked about us being in the throes of the peak sometime about a week or so ago, and it does appear we're on the backside of that mountain. The question is, how long will it take us to get back to those hopefully May and June numbers, which is what we're really hopeful for, or June and early July numbers. So those are big question marks, and of course, then the other question from a school perspective is there going to be another wave or another round? The 2 doctors, I would certainly yield to your expertise on those things. But, we fall, I think this is wave number 3 or whatever we're counting. I'm not sure what that ultimately looks like. But again, so we're still kind of monitoring where we are on the way down. Our current numbers are still higher than our peak last year. I think, our peak last year was January 13th, and our current numbers continue to be higher than that number. But you saw from Dr. Phillips's graph, at one point already we had 700, I think the graph went up to 711 or so active positive student cases. Additionally, I would like to add, and I'd be remiss if I didn't say it, one thing we've seen this year that we did not see last year, something that Nurse Wood talked about, is what appeared to be infections to adults from kids. There was a number of cases where high rates of positive student cases were soon followed by unvaccinated adults being positive, and that actually has resulted in some pretty serious illnesses and some pretty serious hospitalizations. So that's something that was very different, primarily because last year we saw a much less rate of elementary school students being infected. And again, I think today a member of South Carolina Academy of Pediatrics talked about it was more of an adult-to-child infection experience. And Dr. Cotton, you've actually talked a little bit about that. You call it a downward transmission where an adult then gave it to a child. But then what we're seeing is more of an upward transmission where children are giving it to adults. And so we've seen that a number of times. And unfortunately, we've had situations where a spouse of one of our employees has passed away, and then a number of our at least 2 examples of parents of our students have passed away. So, there's been a lot of that was different than last year, I think, overall, especially in terms of quantity and the amount. And that's just kind of where we stand, I think, in terms of the overall impact and where we are over the first. Again, I think yesterday was day 25, or today's day 25 of school, as compared, really, you could take the first 25 days of school this year and apply them to all of last year, and the first 25 days this year actually dwarfs it in lots of comparisons that you saw from Dr. Phillips. So that's kind of where we are in terms of by the numbers. And again, 2 major questions that we still have to go. How long will it take for us to get down the mountain? And then will there be another wave coming at some time in the future? That we certainly don't know of, and because I wouldn't have known in May or June that we'd be sitting here in August. That August would have started another wave. So just some of the points of context of where those numbers are.
Dr. Lloyd, would you kind of agree that our general philosophy is one in which we try to minimize the least amount of impact possible regarding it? I think historically we would see, just by the simple fact of the schools that themselves were shifted to a virtual learning model as opposed to an entire district or a classroom instead of an entire grade. I mean, that's generally the philosophy of Lexington One. Am I correct?
Yes, sir. We have gotten, I think, better and better about how to address COVID issues in our schools. Certainly last year when we first started this whole thing, it was really about these major shifts, we would start with the whole district in a hybrid model. I think what you're seeing this year is a much more boutique approach. So for example, I was jotting down some numbers a moment ago. We had 9 schools that really hit some pretty hot spot kind of areas. And when we look at those schools now, their numbers are vastly improved at this point, which is tremendously exciting on our end. Just to give you an example, Gilbert Elementary School, which was probably our hardest hit school overall, I think at one point they were over 50 active student positive cases in a school of 750 kids, somewhere in that ballpark. You'll have to excuse the kind of estimation, but somewhere in there. Gilbert Elementary School was probably our hardest hit at that time, and currently they have 2 cases. So the virtual shifts seem to allow that to run its course, bring them back, get them back in school. And I think our number one priority, and Ms. Gaskins is sitting back there, and one thing that I'm incredibly proud of our teachers, I'm incredibly proud of the amount of work that has gone into virtual learning. I'm incredibly proud of the amount of work that is taking place to keep kids connected in schools, even when maybe they're not feeling well, but they can still do some schoolwork, those kinds of things. While we are thrilled about that work and her leadership in that work and Dr. Rivers' leadership in that work, our priority still remains face-to-face instruction. And so because we've been able to identify really the hot spots, because while Gilbert Elementary School was hit really, really hard, there were other schools that weren't hit nearly as hard as that one. And so we didn't find it necessary to try and shift everybody's instructional model because there was a real hot spot at one particular school. And again, those schools have bounced back really nicely. Centerville, which was certainly the first school that we shifted to a virtual environment, they currently sit at 4 student positive. So it appears, at least from now correlation is not necessarily causation. I don't know if Dr. Phillips is still here. He's going to be proud of me for using some statistical knowledge on that. We are happy that the fact that those now cases are way, way, way down. And of course, I believe also both those cases we saw after a lot of student positives, there were some staff positives that followed that as well. So those numbers look good across the board. Pleasant Hill Middle School 7, Carolina Springs Elementary School 5, Centerville Elementary School 4, Gilbert Middle 4, Carolina Springs Middle 3, White Knoll Middle 2, Gilbert Elementary 2, Pillion Middle 2, and I don't have a number for Forts Pond at the moment, so I'm not sure if that means that's a 0 or if there's just something wrong with the spreadsheet. But those are all really good places to be compared to where those places were just a couple of weeks ago. So it worked, but of course, again, I think if you ask anybody in here that we want kids face-to-face, but taking that boutique approach, I think, help us keep our entire district. Other districts kind of shifted and did some other things, but I like how we approached it.
And I think in that same vein, as we continue down this path, and you and I have kind of spoken about this, we have to learn to live with COVID, if that makes sense. This is not something that we're going to vaccinate away like smallpox, okay? There's going to be life with COVID moving forward. And I think when people hear that, they automatically go, oh my gosh, I mean, that means we're going to be quarantining from now until, my kindergartner graduates high school. No, that's not the case. But, obviously I have been maybe a little critical of the General Assembly and some of our executive branches of state government. But I also am one who also believes that we should help the cause as well. And so I think the challenge to us at Lexington One is to basically lay the same challenge out to South Carolina Department of Education, to Department of Health and Environmental Control, and to the governor's office of let's all work together to come up with common sense approaches on how to develop life with COVID as we move forward. And I think ultimately that's what every parent wants. Regardless of where you sit on any side of any hot button topic, that's the desire. And so I think that's the challenge before us, and the challenge I would put to ourselves as well as to those other entities is let's work together to figure this out and try to figure out life with COVID as we move forward.
But I do think we need to be clear. Last year, our schools were safer than our community because of all the mitigation strategies. This year, we just heard there is spread in the schools. So there is a educational cost to that, and then there is a loss of life cost to that.
Sure, absolutely.
I mean, our community is sicker because we couldn't mitigate the spread like we could last year.
Yeah, I would absolutely agree that the mitigation strategies that the toolbox we had was bigger, and I think the results that we saw were better. And so I think as we find ourselves in different spots along the COVID map, we have to figure out a way to maneuver, and when we're so tightly constrained that we can't maneuver in any which direction, we're going to have widespread educational impact, which is what we've seen.
Anyone else? All right.